Hi, I'm here to pick up my prescription.
Hi, my name is Eric. I'm the pharmacist. What's your name?
Dana.
Dana, nice to meet you. What's your last name?
Jacobs.
Okay, Dana Jacobs. Well, I just want to let you know I'm going to be going over your prescription with you to help you understand what the medication is for, how you should take the medication, and what you should expect from the medication. Do you mind if I go over your patient profile with you really briefly to make sure we have everything up to date?
Sure.
Okay. What's your birth date?
My birth date is January 1st, 1960.
Okay. And are you still living at 1000 Georgia Street in Vallejo?
Yep.
And phone number is still 555-5555?
Yes.
Okay. And with regards to medications, it looks like you're taking Lipitor. Is that correct?
That's right.
And are you taking any other medications, herbal products, over-the-counter products, supplements besides the ones listed on your profile?
No.
Okay. And any allergies to any medications?
Not that I know of.
Okay. Well, you've been prescribed Actonel 35 milligrams. This is what the package looks like. There are 4 tablets in this container, and you're going to have 6 refills. And it's important to keep the medication stored in a dry, cool place away from children. What did your doctor tell you this medication is for?
Well, they kind of didn't really go over it too much. It was kind of fast.
Okay. Well, Actonel is used to help treat or prevent osteoporosis, and it actually works by increasing your bone density, which will help decrease your risk of getting a fracture in the future.
Okay.
How did your doctor tell you to take this medication?
I actually don't remember. I mean, he told me a lot of things, and, he told me the pharmacist would tell me.
Okay, I'll go over that with you.
Great.
So you want to take 1 tablet by mouth once a week,
Okay.
and you want to pick a day that's most convenient for you. So what day would be most convenient for you?
Usually a Wednesday.
Okay, so every Wednesday you want to take 1 tablet by mouth every Wednesday. And there's 3 important things I want you to remember. So you want to take 1 tablet on an empty stomach with a full glass of water.
Okay.
And secondly, you want to make sure you stay in an upright position for at least 30 minutes. So either sitting or standing for at least 30 minutes. And number 3, no food, drink other than water, or any other medications for at least 30 minutes after taking this medication. Okay? And if you miss a dose of the medication, no big deal. Just take it the next day, and then just go on with your regular schedule every Wednesday.
Okay.
Okay? And what did your doctor tell you to expect from this medication?
Nothing really. There wasn't too many things I had to worry about.
Okay. So Actonel is actually very well tolerated, but some patients notice a little bit of heartburn. And this can easily be prevented by making sure you take the medication with a full glass of water to flush that tablet down, and making sure you stay upright in the upright position for at least 30 minutes. So being either sitting or standing upright for at least 30 minutes.
Okay.
What lifestyle modifications did your doctor make for you with regards to improving your bones?
He talked to me about some exercises that I should be doing more often. Basically just working out a little more because, to strengthen my bones. Exactly.
So you want to think about weight-bearing exercise, so
Okay.
walking, even lifting weights,
Okay.
things that can basically help your bones get a little bit stronger. And you also want to think about getting enough calcium and vitamin D in your diet. Do you take a calcium supplement?
Not right now. Do you recommend something?
Yeah, I would actually recommend taking any of the over-the-counter calcium with vitamin D supplements. Okay. And
I did have a question real quick.
Sure.
Calcium supplements, I noticed that there's a lot of different types. Is there one that you recommend?
There's many different types, but I would actually go with the calcium carbonate. And if you're going to take more than 1 dose a day, you want to make sure that you at least space it out. So take 1 in the morning, 1 in the evening. Okay. And just in case I missed something or left anything out, can you tell me how you're going to take this medication?
I'll try. Basically, the Actonel is for my osteoporosis.
Correct.
I'm going to take that once every week on the same day each week. So I picked Wednesday, so every Wednesday I'll take 1.
Correct.
Best to take it in the morning, usually first thing in the morning because empty stomach.
Empty stomach, good.
Right? And then I know that for the first 30 minutes after I take that medication, I need to either be sitting or standing or even walking around, but just not laying down for 30 minutes.
Correct. So make sure you're in the upright position, and also remember to take it with that full glass of water.
Oh, okay.
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 And then with regards to lifestyle modifications, think about getting enough calcium and vitamin D in your diet, as well as incorporating some weight-bearing exercise. Okay. Any other questions for me?
How often should I be doing this exercise? Like, the doctor said do it every day, but what do you think?
I'll say, if you can get weight-bearing exercise in every day, that'd be great. But just kind of start gradually and build it up. Okay. So, any other questions?
No. I think I'm If I did, I can always call you.
Yeah, so anytime you have questions, feel free to stop by the pharmacy. We'd be glad to help you out.
Great. Thank you very much.
You're welcome.